Well, welcome everyone. I'm here with Dr. Luis Garcia, and we're going to be talking about biomagnetism, bioenergy, and beyond. Dr. Luis Garcia, growing up in a medical family, followed the passion of his father and grandfather and chose this field with a vision to serve the people. He received his Bachelor of Science degree in biology from Boston College in 1997 and his medical degree from Universidad, I'm not going to be able to say that correctly, in Bogota, Colombia in 2005. And then Dr. Garcia served as medical director and chief science officer at Salud Futuria Clinic in Bogota, Colombia until June 2010, where he worked with neurofeedback, neurotherapy, ozone therapy, homotoxicology, neurolinguistic programming, chelation therapy, DMSO therapy, bioenergetics, nutritional therapies, biological medicine, traditional Western medicine, and biomagnetism. His extensive practice has given testimony of how biomagnetism may improve the lives of those with diabetes, fibromyalgia, chronic fatigue, Lyme, allergies, memory problems, digestive, respiratory, and cardiovascular issues, among other health complaints. His goal is to stabilize the body's pH and stimulate the immune system through the use of magnets and bioenergy. Dr. Garcia, I've heard so much about your work, and I'm so excited to interview you today. And this being the Body Electric Summit, we have to talk about biomagnetism. And as your bio, we just shared your bio, you have a ton of experience, and we were chatting before this call. You really are on the front lines of seeing the same patients that we see at Sophia. And I know that you've learned so much through really your clinical practice, and you just have so much valuable information to share with us today. So thank you for being here. And
thank you very much for having me.
Yeah. So many people might this might be a new concept for them, and they might have heard about magnetic therapy or magnetism or magnet therapy, but really what is biomagnetism?
Sure. So biomagnetism, bio means life, magnetism, the magnetism or the magnetic energy that life has. And so biomagnetism deals with the use of magnets, as we can see here. I have 3 different sizes, and so I'll pull up the large ones. Here is red, and on the other side is black. So there's North Pole and South Pole magnets. And when you place these on the body, it can help correct different energetic imbalances. And so the trick is, or not necessarily trick, but the most important thing is placing them correctly. So normal magnetic therapy oftentimes only uses 1 magnet placed on the body, whereas in biomagnetism, it uses 2 magnets. So it's actually a very specific technique where you need to use a dual placement of magnets in opposite directions or polarities to either draw the energy from one to the other or push the inflammation away from an area. So magnets will move hydrogen protons around in the body. So when we have inflammation or infections or dysfunctions in an organ, in an area, a space, bone, kidney, ligament, joint, organ, you can use the magnets to draw the protons either away from the area or towards the area, thereby increasing circulation, reducing inflammation, restoring the natural pH to that particular area. Just like a swimming pool or an aquarium that has to maintain its pH balance, through the use of magnets, you can help restore that pH balance to the different organs. And so thereby reactivating the body's normal functions.
Mm-hmm. So you brought in this idea of hydrogen and pH, and maybe for the average listener, they don't understand how those are connected.
Sure.
And you studied biological medicine and homotoxicology, and this is a big foundational piece of, I would say, European biological medicine, looking at the terrain and looking at optimal
Absolutely.
pH in the body. So please, share more about this idea.
Absolutely. So our body functions optimally at a pH of about 7.365 to be exact. There's a slight difference between arterial blood pH and venous blood pH, as well as the pH found in different organs, such as the stomach. It usually has a much lower pH to help digest food. But when there's an infection, a dysfunction, inflammation, when our body is off in any particular way, that pH balance, that matrix, that um, zone is no longer appropriate or optimal for that organ to function appropriately. And so through the use of the magnets, you can restore. So when we eat alkaline foods, the majority of fruits and vegetables, they have a pH greater than 7, the 8, 9, 10 range. The more raw we eat them, the higher the pH value. And so pH stands for hydrogen potential. It lets us know what the particular hydrogen, not necessarily content, but how our body responds to it is. And so even though we may taste a lime or a lemon, sure, it tastes acidic, but it creates an alkalinizing response from our bodies. So when you have normal neutral pH tap water and you add a lime or a lemon, you squeeze that into it and then you drink it, it will actually have an alkalinizing effect. And so it helps our body to detox, it helps restore pH balance to our overall body. As opposed to when we eat highly acidic foods, such as hot dogs and hamburgers and wine, alcohol, cheese, pastries, microwavable foods, preservatives, chocolate, popcorn, black tea, coffee, et cetera, all those no-no foods that we've been told for years that we all know about, but unfortunately, choose to eat on the weekends or whenever, they will acidify us and they'll drag our body's pH down, as opposed to the healthy fruits and vegetables, which will help maintain it higher. So my recommendation for everyone, and that obviously my family and I follow, is that we eat a 80-20 diet, which 80% alkaline as much as possible, fruits, vegetables, salads, obviously raw is best. Sometimes we'll steam them, saute them, boil it, depends on what we're having. But you can have 20% slightly alkaline, slightly acidic. So slightly acidic foods are chicken, fish, turkey, eggs, quinoa, beans, lentils, rice, etc. So those are okay in about a 4-to-1 ratio or 80-20%. But the no-no foods are the ones that I previously mentioned that, if you have an upset stomach and all of a sudden you're having cheese, you're throwing in pizza, you're having a hamburger, well, of course it's going to make your stomach even worse. The best thing that you can do for an upset stomach is have something that's alkalinizing and that will help your body detox, like, lemon water, or have Alka-Seltzer, which will alkalinize and raise the pH. The other things or conditions that will also acidify our body the most are stress, worry, lack of sleep, or overworking. If normal work week hours are maybe 40 hours a week, but you're working 60, 70, 80 hours a week, well, of course, that's going to drag you down and rob your body of all of those extra hours of sleep and rest that your body needs to be able to raise and maintain that proper pH. The other thing is, unfortunately, even though dairy, whether it's cream, yogurt, kefir, milk, pasteurized or raw, organic, you name it, even though the majority are in the 7.0 range, which is ideal where you'd like to be, unfortunately, all dairy products will feed virus, bacteria, fungus, and parasites. So once again, if we go back to the gut and our microbiome is off because we have an excess of bad bacteria or too much yeast or certain gastrointestinal viruses or even parasites in our gut in different areas, we have dairy, and that's just going to feed all of them, and it's going to add fuel to the fire. So if you have a fire raging, whether you add alcohol, wood, paper, plastic, gasoline, they're all going to make that fire rage to a different extent. So through the choices in our food and our lifestyle, we can help maintain a certain alkalinity or an alkaline balance to our body. However, if I have a headache right here, say it's a sinus headache just over my eyebrow. It's not like I can eat raw broccoli and that broccoli is going to go and it's going to alkalinize my the area in my prefrontal lobe and get rid of the headache. No. However, if I use a magnet and I use the black side of a magnet to push the hydrogen protons out of that area to push away the inflammation, I can place a black magnet on the right side and a left magnet on the left, and a red magnet, on the left side. And the color I'm mentioning is the color that goes towards the skin. And this will increase circulation between my prefrontal lobes, and it will also have a drainage effect. So not only will it help pretty immediately drain whatever is kind of causing that headache, but it will also improve the flow of red blood cells in the area. And so how do I determine, or how does a therapist that performs a biomagnetism technique know exactly if he places a black here or a red here? Because oftentimes if that doesn't work, then you can try red over the area of inflammation and then a black on the bladder to drain that inflammation down to the bladder so that you can pee it out later. If there's excessive inflammation, or if it's a very acute trauma or something happened, you can also use the kidneys to drain that inflammation through. You can also use the inguinal lymph nodes, or you can use the liver to drain. And so how are we going to determine all that? Through either autonomic response testing or what we call muscle testing that we work in biomagnetism. You can work either through the feet or the hands. And so with the feet, the majority of us practitioners like to work with shoes, and these are normal, say, work shoes that simply have the fronts cut off so that all different sizes can fit in there. And so we have the person lay down. And so if they're laying down in that direction, their feet are facing up, I have their heels here. And so if you can see, the edges are lined up. When I place a magnet over an area of inflammation on the patient, one of their legs will shift and they'll have a muscular contraction. Not sure if you can observe this change here, but that lets us know that, okay, there is inflammation in that area. Now, where do I place the second magnet? And so until you find the exact specific spot for that second magnet to go, whether it's the liver, the kidney, you name it, it could be anywhere on the body, the leg will not restore back to its normal position. And so only through the muscle testing or kinesthesiology can you determine where you have to place that second magnet. So once again, just to conclude this topic that I kind of went around a lot, can't stress enough the importance of our nutrition. However, when we've done all that and it still doesn't work, that's when you have to go to some other technique. And so in this technique of biomagnetism, or what I like to call dual placement technique, because it involves the placement of two magnets in pairs, that's when you can restore the leg length of the individual. And you know that, okay, here's where the body goes back into its optimal metabolic and pH balanced alkaline state.
No, thank you for sharing all that. And I'm glad you touched on, this whole idea of setting the foundation for health, and this whole idea of, excess acidity, and how that usually, leads to a lot of symptoms. And so, Dr. Klinghardt, for his lecture on the summit, talks about autonomic response testing and how that works. And many of us who are in the field of treating people with complex chronic illnesses, we all have our tool to really check in with the body and figure out how we can prioritize treatment. And so if this is a new concept, if you're listening, many of us on the front lines who are treating patients, we wouldn't be able to see the results, I believe, that we all do if we didn't have a technique like this to check into someone's individual body and prioritize. Because without that, you're just really guessing. You're just making educated guesses. So, and I just like to share here too, like many patients find us after seeing 20 to even 50 doctors. And so they have had this opportunity for that other methodology to work. And unfortunately for chronic illness, we're left short with results because there isn't that acknowledgement, or I think that the paradigm isn't there to, for every doctor to check in with the patient like you're saying. So I just wanted to put that out there. And so Dr. Garcia, you're talking about obviously using magnets, and it's very specific, and it's they're used in pairs. They're not used alone. And
correct.
The light bulb for me that has turned on hearing you is how you're increasing flow and drainage and circulation, to the areas where there are problems. And ultimately, I do see a foundational piece of why people are sick is this lack of proper lymphatic drainage, lack of microcirculation, low oxygen in the tissues. And so can you talk a little bit more about, how, these paired magnets, what you've seen with increasing lymph drainage? And what I'm hearing is that you can get a symptom improvement pretty quickly, but is this something that you maintain the results, or do you have to do repetitively? Do you teach patients to do this at home, or is it always in a clinical setting? But just sharing a little bit more about that.
Absolutely. There was kind of a barrage of questions that you
asked. And I didn't mean to overload you, but just about, please do. And so I just, go with wherever you want, but this whole idea of how to, just breaking this down for the listeners so they understand what's happening.
Absolutely. So in my sessions, particularly, depending on the issues, the imbalances that I find, I prefer that the patients take home magnets with them so that they can reinforce the work that I have done and continue the progress going. At the same time, in the majority, I will find certain infections and have to recommend that, this cough that you have had for the last 6 weeks, that you've taken numerous antibiotics and it hasn't worked, I feel energetically that other family members are sharing it. So even though we could do a culture analysis of the phlegm that comes out and say it would come negative for strep, I still find the pH imbalance that's left over from that strep infection. So they received antibiotics and it, quote unquote, may have eliminated the strep, yet the inflammation is still there. So they may go, another 4 weeks before finally the cough goes away, but it's now a reactive cough. It's just inflammation that's left over and the body hasn't recovered appropriately. So through the use of magnets, I simply restore the pH and the body heals, sometimes instantaneously within minutes. Other times it may take 24 hours. Other times it may take 2 or 3 weeks. It depends on, how much inflammation there is and what other underlying issues are occurring. But oftentimes, so the mother took the antibiotics, she still has the cough, yet one of her sons also has the cough. He hasn't taken antibiotics, but if that mother goes home within 2 or 3 weeks, her son has given her back the strep and she persists with strep and she'll take other antibiotics, yet it is now inside the home and it's going from child to the husband back to the mother. And so it just becomes a merry-go-round. And 6 months later, the entire family has been on antibiotics and it just around and around and around it goes. And so by having them take home magnets, she can place the magnets on their lungs, on their pleura, on different areas of the body to help stabilize the pH imbalance where either the the strep infection was hiding out, or where it was causing the most inflammation, whether causing the reactive cough or the phlegmy throat or the postnasal drip, you name it. And so that way we can take care of the entire family, and that way her issue will go away much faster. So it's not necessarily focusing in biomagnetism therapy on the symptoms as much as the underlying issues. And so that's where, unfortunately, conventional medicine errors, because they focus just what's your symptom. You have a headache, let me give you an anti-inflammatory so that you no longer have a headache. No, you still have the inflammation. It's just your body can't feel that symptom. You've turned down the volume. You haven't actually solved anything for that individual, much less raised or stimulated their immune system so that their body can overcome whatever was causing that in the first place. And so the mental focus should be, okay, why is the body responding with inflammation in that particular area? Is there an infection? Is there an emotion? Is there a nutrient deficiency? Is there a toxicity overload? What is going on? And so through the work of biomagnetism and the bioenergy work that is done with it, you can determine exactly what is going on. And so in some individuals, they have a massive headache because of underlying emotional issues that they have. They're going through a major divorce. And as much as they don't want to admit that all that stress is causing that, they can take all the painkillers they want, but that emotional stress that they're going through is what's causing that. Mm-hmm. And so everyone is different, but once again, using the bioenergy work and learning how to think about disease and health in a different light is just so amazing for patients, because once again, they've been for years suffering from a lot of these things, and nobody has been able to come up with an appropriate solution until you start thinking outside the box and stop thinking about, well, let me just turn down the volume, because ultimately the volume is going to be raised in another organ, in another area, through a different mechanism, and the body is just going to continue to keep trying to talk to that individual and show them different signs and symptoms, yet they're going to take another painkiller, something else that's stronger. And so ultimately you're throwing the body off in many more ways, on a chemical level, on an energetic level, on a nutritional level, because you continue eating the same foods that are unhealthy for you. And just to give a few examples, and once again, everyone's different, but I personally do not leave home without my magnets, like the American Express card and others. Never leave home without them. And so this past 4th of July, we went up to Lake George with friends, and it's a huge lake upstate New York, and you rent the boat and you go out for hours. And so I took my magnets and I put them in my pocket, and I said, I never know. I never want to, be without them. We rented the boat. We were on the water 5 minutes, and my friend's wife said, I think I have to go back to shore. I'm feeling nauseous. I'm seasick. Sorry to do this to you guys, but, I'm about to lose it. And I said, wait. I have my magnets. And I pulled them out of my back pocket, and everyone was like, no, you did not bring your magnets. Of course I did. And so I said, okay, this should be easy enough. And so in her case, I grabbed her arms, because you can do the muscle testing through either legs or work with the person's arms. The arms, not only can you do the muscle test of when you try to push it down, that's the typical ART, or you have them make a fist. And so if there's a positive response, one arm will contract relative to the other, or it will actually extend relative to the other. So in this case, I simply grabbed her arms and I asked her body very specific questions in terms of what is the underlying cause of your imbalance issue. Why are you getting seasick? Is it due to an infection, an imbalance in pH, this, that? And I got my appropriate responses. And so I figured out that I needed to place 2 magnets behind her head in this particular direction, vertically, one black magnet on her medulla oblongata, the brainstem, and the other magnet on her cerebellum. And fortunately, she was wearing a baseball cap, so I slipped them underneath. And then I asked her body energetically, will you require another pair of magnets in order to alleviate this seasickness? Her body responded no. And so I asked, okay, how many minutes? 18 minutes. We had to leave the magnets on. And so I said, in how long will she receive improvement? And so I muscle tested, used the bioenergy technique, and responded in about 8 minutes. She'd start to feel better. So I said, all right, let's anchor down. Let's wait about 10 minutes, and then we'll start the boat back up again and see, how she feels. And so we did that. And then she said, I think it's gone. We took off full throttle, and her seasickness was gone, and we were able to continue with the rest of the 3-hour boat ride. And so, all it took was less than 20 minutes of leaving the magnets in the back of her head. And so she no longer needed to take any type of medication or look for acupuncture points in the wrist or elsewhere. It was simply a matter of placing 2 magnets in the exact location that her body responded where she needed it. And so because of that particular location, amongst the answers and questions that I did, I was able to figure out that she had scrambled eggs that morning, and they were a little on the raw side. And so it was because of those eggs, they happened to have been contaminated with a particular virus that goes to the cerebellum and causes some equilibrium or balance issues. And so once again, that was solved, pretty quickly, and we were able to enjoy the rest of the afternoon on the boat.
That's a fun story, and I'm sure it's in. What I'm thinking too is, the magnet pairs seem kind of like a pretty elegant but very simple technique. And you've studied, Dr. Garcia. So, when I read your bio, you're very well educated. You've studied a lot of conventional, but also very alternative techniques, and you've stuck with, biomagnetism. How did you find biomagnetism, and really what made you so passionate about it?
Okay. Yes. Excellent question. And so it's interesting because after college, or as I was in college, my father, who went to Columbia to learn medicine, a little bit better, only because medicine in Columbia is 7 years as opposed to 4 years here in the United States. And so I thought, 7 years as opposed to 4, but all right, I'll give it a try for a year. So I went for a year after college and just loved it, fell in love with the country, the culture, everything, and realized that, yes, I would become a more well-rounded medical doctor if I did the training in Columbia, only because here in the United States, it's of the 4 years of medical school, it's 2 years academics and then 2 years rotation through the different specialties. In Columbia, it's also 2 years academics, but 5 years of rotations through the specialties. So in the United States, as you know, it's 6 to 8 weeks rotation through each individual specialty. In Columbia, it's 6 months. So it's 6 months of OBGYN, 6 months of surgery, 6 months of pediatrics, 6 months of, you name it. And so by the time I graduated, I had delivered over 150 babies by myself. And so, you're kind of thrown in the water, and either you sink or swim. You got to learn all these things very quickly. And so I did that. And after graduation, I said, all right, I feel like I can conquer the world. Let me open up my own medical practice. And I did. And in those first few weeks, a patient came to me and said, I have reflux. I've been to, top 3 gastroenterologists in the city. they're older and, you're a recent graduate. What do you have that's new for me that's going to take away my gastritis? And I said, more antibiotics. And he was like, no, you can't help me then. I thought you were bringing something new to the table, but if you're talking to me about antibiotics, I'm not interested. And so that just hit me hard. Like, wait a second. I just, spent 7 years studying, and what do you mean it's not helping? And so that was frustrating. And that kind of led me on this path to look for what else is there that isn't conventional medicine. And that's when I started to study neurotherapy, homeopathy, homotoxicology, a little bit of acupuncture, this and that. And so I started to incorporate them. And so I would see people with gastritis and say, okay, I just learned these homeopathic drops. And so take this, take 10 drops of this, and then 3 hours later, take 5 drops of this. And it was combining. And they're like, whoa, that's too much. Like, it's complicated. And so I then learned neurotherapy with Procaine. And so they would come in and I'd say, okay, let me do this, gastric circle, and let me do these points and this and that. And they're like, ow, it hurts. I'm afraid of needles, this and that. And they'd come back a week later. Okay, it helped, but I don't like needles. What else do you have for me? And so then I learned ozone. And so I used ozone injections over the same neurotherapy points, and combined with homeopathy and homotoxicology. And so, yes, patients got a little better, but still it was so many things that I had to combine. And then I was always thinking, okay, I got them better a little bit, but it's still not 100%. And they're coming back every 4 or 5 months. Granted, their gastritis or whatever issue isn't chronic, but it's still coming back. And so that's when I found out about biomagnetism, and I met a doctor that when I spoke to him, he said, look, I do biomagnetism, and my life can be divided in two: before biomagnetism and after biomagnetism. And, if you're as open as I think you are, this is going to be the therapy that beats all therapies. And so, for someone to say that my life can be divided into two, those are big words. And so I started looking it up, and before I knew it, I was in Ecuador learning biomagnetism from Dr. Goyce himself. He invented this technique over 30 years ago. And so while I was at the course, he asked in the first day, who here has an arm or a leg that's longer or shorter than the other one? I raised my hand because for my entire life, my right arm was longer than my left. So was my father's, so was my grandfather's. And so when I discovered that in myself, I was about 15, I was going to the gym and I was doing bench presses and lat pull downs, and it was always uncomfortable because they were slightly off. And so when I asked my father then, Dad, what can be done about my arms? They're uneven. He said, son, it's genetic. One of your sons or daughters will also have it. There's nothing you can do about it. Welcome to genetics. And at the age of 15, you're like, okay, that's what my father, medical doctor, says. I got to go with it. When Dr. Goyce, fast forward, that first day of class, asked that, I said, well, I've had my right arm longer than my left my entire life. He said, come over here, lay down. He placed 2 magnets on my body. And ever since, my arms have been even ever since, just with placing 2 magnets. So what I ended up having was a pH imbalance. I had an acidity in my left shoulder that forced and caused a small muscular contraction here. I swam for over 4 years. I did all types of different sports. Nothing ever released that pH imbalance that I had. The only thing were 2 appropriately, very specifically placed magnets that, boom, then released that contraction and allowed for my arms to be the exact length that they were, that I was born with, just I acquired a low pH imbalance. And so that blew me away. And being a conventional doctor, or having the conventional training, yet having experienced all the other different techniques and modalities, I said, wait a second, this can't be, so miraculous. Like, let me really try this out and let me, prove this to myself, because the things I learned during that seminar were just way too miraculous to kind of fathom and really put my head around. And so when I got back to my office, I told my nurses, all right, from now on, I'm going to do magnets on everyone, and I'm going to do some experiments and this and that. And so I started to see patients with urinary tract infections, and I would have them go to the lab, drop off their urine sample for a culture for analysis, and then come back to my office that same day. And I would do the magnets on them, and I would detect that they had the pH imbalance issues relating to either E. coli infection or Klebsiella infection or, you name it, urinary tract infection. I would place the magnets on very specific areas of their body where those infections were hiding out, causing inflammation and the UTI. And then I would have them come back 3 days later with the lab report, and the lab report would say either E. coli or Klebsiella or whatever bacteria that I actually had detected. And I would ask them, how did you feel after our session? And they would all respond, felt great. The burning, all the symptoms disappeared, and, I feel good. And so I would then have them go back to the lab, drop off another sample, have it be cultured, and then come back another 3 days later, and everything would be negative and clear, and they would not need any more antibiotics or any antibiotics, period. Yet they came for chronic UTIs. Once I started placing magnets on them, it cleared permanently. And
Wow.
so I did that for pneumonias, for bronchitis. I did that for renal or kidney stones. I did it for gallbladder stones, for many different issues that you could prove with laboratory analysis. And so I would, first see the altered analysis. I'd place the magnets and then have them a week or, a few days later, go back to the lab, get another analysis, and it would be cleared. And so it was just amazing how fast some of those things resolved.
Mhm.
And that, for me, was just an eye-opening, awakening experience to realize that, wow, I didn't need to write a prescription for painkillers, for antibiotics, for anxiety medication, for you name it. And so I just started testing and applying my knowledge and going to more seminars. And before I knew it, I had gone over a year without touching my prescription pad because I didn't need to write anything for them. I was solving it with using the magnets. And so
Wow.
that's kind of what led me to where I am. Yeah.
Yeah, no, it's a wonderful, personal journey. And obviously, your patients taught you every day to stick with this and the results you were
Yes.
seeing. And, we talked a lot about a lot of different conditions that people might be thinking, or is biomagnetism a therapy that I should try for my own body? I, of course, see a lot of chronic illness, and there's this whole conversation about chronic Lyme disease. And you mentioned the, fungal and parasitic infections and heavy metal toxicity. And then we're all exposed to herbicides and pesticides and EMF and, all of these things. And so, do you feel that, with the chronic nature of the conditions we're seeing, that people, really to maintain their health, like, do we just have to continue to use biomagnetism to maintain our health? Or do you really see it as, curative and, people can get to this next level of health and ensure maybe for maintenance, but just kind of reframing how we look at these chronic conditions? You mentioned a really great example with the strep, and then kind of the imprint and the pH that it left behind that wasn't resolved, as well as the exposure that was going. So just, my goal here is to help shift the paradigm of how we think about these things in this conversation. So just maybe giving people more hope out there who might be struggling, with these complex chronic illnesses, and how this tool can be so helpful for them to regain their health.
Yes, absolutely. So this tool is, I would say, honestly, and of course, it's going to be my experience because I've been doing this now for 11 years.
Mm.
Yet, with my knowledge of all the other techniques out there, I would say this is the one that really can unite them all, only because of the bioenergy aspect, where I can ask the body, is there an underlying nutritional deficiency? Is there an underlying toxicity issue? Is there an emotional issue? Does this require magnets to rebalance, et cetera, et cetera? And so the majority of the time, 9 out of 10 times, yes, the body will benefit from the magnets. And occasionally, or I would say, 8 out of 10 times, there are absolutely other factorial issues involved. Just like cardiovascular disease, we all know, has to deal with genetic issues, sedentary lifestyle, high cholesterol, hypertension, diabetes, smoking, etc. The majority of issues and conditions have to do with also underlying heavy metal toxicity, nutrient deficiencies, have to do with a low magnetic energy state. And so with the magnets, you can restore that state. Has to do with pH imbalance issues, has to do with emotional issues, has to do with other spiritual issues as well. There are so many different factors involved that through the use of the bioenergy work that biomagnetism requires, you can actually pinpoint which one is higher on the scale. And so you mentioned Lyme disease, which is what I tend to see the most of now. And so I do have a YouTube video out there where I talk about Lyme disease. And in my experience, Lyme isn't just about the Borrelia burgdorferi infection. It's about all the co-infections that are involved that unfortunately everyone is only thinking about, okay, maybe there's Babesia or maybe there's Bartonella or Mycoplasma pneumonia, but nobody's thinking about, is there underlying Epstein-Barr cytomegalovirus? Is there a fungal issue because of the overuse of antibiotics? And so there's candida overgrowth, and there are other yeast or mold toxicity issues. And are there other bacterial infections, such as an underlying tuberculosis or underlying Yersinia species infection, or underlying parasitic infections, such as malaria? And so I'm finding more and more that Lyme patients have underlying malaria. And so you would think, but wait a second, malaria isn't in the United States. How is that possible? No, it actually is, unfortunately. And so somebody goes down to the Caribbean or goes to Africa or India or Latin America, and they're bitten by a mosquito. And then a week later, they come back to the US, but their immune system is strong and healthy. They were on vacation. Everything is status quo. But then 1 or 2 months later, their immune system dives. And that's when out comes the malaria or the Zika or whatever infection they acquired down there. And then they can be bitten by a mosquito, and then that mosquito takes in their malaria, and then it bites their neighbor or, somebody in Central Park who hasn't, flown out of the country. Now they have an underlying issue. So Bartonella can be spread through mosquito infections. And so people are being bitten by mosquitoes and black flies and green flies and all these things constantly. And who's to say that a fly or a mosquito isn't biting a deer that has Lyme, and then that mosquito a week or two later bites a human? It now gave that human the infection from the deer or, whatever animal it had. And so unfortunately, mosquitoes, flies are spreading a lot of this. And so when I apply biomagnetism therapy to these individuals, I find these layers of infections. And so in the first session, I'll get rid of, 1 or maybe 2 layers of infections. And then in the next session, I'll be able to see other layers that were underneath. And so our body is like this glass that it's able to withstand different inflammation, infections, imbalances, emotions, trauma, you name it, until it reaches its limit. Once it's reached the top, it will spill over. If it spills over here, you've got neurological issues. Over here, you've got musculoskeletal. Over here, digestive. Over here, sleep issues, hormonal imbalances. And so with biomagnetism, you can actually, through the bioenergy work, ask the body and be able to ascertain what the most important things are so that you can bring these levels back down so that the person will regain their health in the most optimal, efficient, ecological way. And so, is it about first addressing heavy metal overload issue? Is it about the nutrient deficiencies? Can you do them at the same time? Yes. Is it about the pH imbalance and low magnetic energy state? Absolutely. And so, once again, for me, it has been the overall unifying factor where I often have to tell the patients, look, in your particular instance, it's your, relationship with your husband or your children that's causing this underlying stress, which is causing a lowered immune system, which has allowed for this infection to take over. And so you can use these supplements to help raise, your nutrient status so that then your immune system can kind of kick in a little bit more, but you also have these heavy metal toxicity issues. So you want to take some chelators and antioxidants here, but you also have to work on, your relationship with your son or your daughter or your spouse, because that is what behind the scenes is bringing everything down.
Mm-hmm.
It's through the bioenergy work of biomagnetism that you can discover all of those things. And so you can place the magnets on different areas of the head that will help reduce the sympathetic nervous system, the fight or flight response that makes you be on edge and with anxiety and hypervigilant state, so that you can kind of bring things down so that, sure, what would normally set you off and put you in a state of anxiety or insomnia, all of a sudden you're like, it's not so bad anymore. Mm-hmm. And so it helps change your mindset when you can reduce all of that inflammation that you have going on in the brain. And so it's kind of like when we stay up late at night or we haven't slept well the night before, how do you feel the next day? You're groggy, you're cranky, you have a short fuse or short-tempered. Somebody could say hi and you're like, you bark. Mm-hmm. And so with biomagnetism during the sessions, you tend to feel very relaxed, very mellow, very just, you're in a sort of hypnotic state, yet you can also learn to maintain that through the placement of magnets to keep everything at a much more stable place energetically, or rather in terms of pH balance in your brain, in your central nervous system, in your muscles, joints, etc.
Mm-hmm. No, I love that you shared this framework, and I have a similar understanding of what our patients are going through too. I think Lyme is a great a way to dialogue about the complexities of what we see, but it's this whole ecosystem, and there's not just one infection, but all of the infections that you shared, and then the layers of toxicity and trauma and how that all intersect. And so obviously this is a tool that you found to really work on all these layers. And I think that's a really important framework as we're shifting people's idea of how you get better when you're suffering from a chronic illness. It's not just one thing and one treatment, or you wouldn't be so sick. That would be a lot easier. So Dr. Garcia, what are you most excited about, and where do you really see the future of biomagnetism? You're obviously have a very full practice, and you're training other practitioners, but to get more people access to this form of therapy. But what is exciting you the most about the future of biomagnetism right now?
That's a huge open-ended. I love it. So what's exciting me the most is the results, you can't deny them. And so just the other day, one of my patients that her daughter happened to have some dizzy spells. So, of course, she brought home the magnets and placed them on herself and her boyfriend, and she was able to heal herself of those dizzy spells after she learned the proper placement. And so the mother was then at a friend's house, and she happened to have a huge vertigo attack, and she was carrying the magnets in her purse. And so she texted me and was like, is it okay if I place, the vertigo pairs on my friend or the dizzy pairs on my friend? And I, responded, yes, of course, by all means, do it. And she did it. And in less than 3 minutes, her friend's vertigo attack, that usually when they came on and lasted for days, it resolved completely. And so here was one of my patients that was able to solve something for somebody else. And so there's no denying that it works. One of the challenges in the future is going to be, how do we get this out there to the mass, to the masses so that they can find out about it? And unfortunately, we don't have the millions of dollars worth of research that, big industry has in order to prove this, but it is absolutely growing from just word of mouth. And so, one patient has a tremendous experience of that, and they tell the other person and the other, and just, now not only do I see that mother and her daughter, but because their health improved, I saw her 3 other sons, and I have yet to see the husband. He'll be in soon. And so, it just spreads because everyone is observing these improvements, and it's all by word of mouth. I've done no advertising whatsoever. It's just people realize that, oh my goodness, this person was in terrible shape. All of a sudden, they are, in such a much better healthy state. What did they do as a result? And so what I'm most excited about, once again, is the future of biomagnetism after we get it to the masses. And so the way I'm trying to do that is through offering seminars several times a year and training others, whether it be health practitioners or, housewives or people that have never had experience in healthcare. Because all you need to know is, study and read and practice and use the magnets in very specific areas of the body to create that stable pH environment that allows for the body to then heal. So I'm definitely very excited about the future, say 5-10 years from now, obviously not next year, but there are thousands of therapists out there that can continue to spread word and have just these tremendous healing effects and experiences with their friends, with their family, and realize that, wow, I no longer need to suffer with these different conditions, everything from, seasickness to you name it, breathing issues. Just 2 weeks ago, I was seeing a patient. She was laying down, but her caretaker had a horrible asthma attack. And so I told the individual laying down, I said, do you mind if I place a few magnets on her so that, I can help her breathing? And so I immediately placed maybe 12 magnets on her, and immediately, almost instantaneously, her asthmatic attack disappeared. And so she went from the wheezing and then just to absolutely breathing calmly. And she couldn't believe at the end of the 15 minutes that when I took the magnets off, the difference. And she was, thinking, why did I leave my inhaler at home, and how could I have not brought it? And it must have been the walk. It must have been the heat. It must have been, something. And so she was blown away, and I happened to run into her this past week. And, I said, how have you been doing? She said, amazing. Haven't used my inhaler since. and my lungs feel completely better. And so, for an individual like that, sure, I'm going to have to see her maybe one or two more times and then teach her where to place magnets on herself if that event happens to repeat itself. So in some cases, you can teach the individual, all right, where do you place the magnets? Are they on the tops of your lungs or on the sides of the lungs or on the back of the lungs, to help restore balance to the lungs, either from the sides, from the back, from the front, from different areas, so that you're maintaining that proper pH balance that was thrown off through different conditions, whether it was the atmospheric pressure or the heat or an infection or, dysfunction, whatnot. Fortunately, through magnets, you can start to restore that and get the body to heal itself.
Mm-hmm. Well, no, I really appreciate you sharing, all of your knowledge and your passion and these stories. And, through the summit, we're getting the word out. And if people want to learn more about your work or how to train with you or how to learn more about biomagnetism, where can they find you?
Sure. So you can visit my website, which is worldwideweb.usbiomag.com. And there's all the information necessary. And another thing that I did about 2 years ago, which has also been helping out the community and the masses, is I developed an app that you can download on your phones, or whether it's Android or Apple system, iPads, etc. And you type in the different health issue that you have, and it will guide you towards where you place the black magnet on yourself and where you place the red magnet, so that can have a balancing restorative effect for your body if you place them in the correct areas. And so it's not very particularly user friendly for those that have never experienced a session or don't know what's going on in terms of biomagnetism, but it's more geared towards either the practitioner to have as a handy tool, reference tool, or for those that I've already seen once or twice that now they're used to, oh, okay, so the magnets, it's no big deal. I shouldn't be afraid of them. And, I can play around with them and place them on different areas of my body. And so I've tried to teach and instruct them to use magnets either on a daily basis or weekly basis to keep their energy levels up and to help restore and maintain their body's pH. And so, once again, it's amazing how a simple pair of magnets like these can do so many things on so many levels in terms of, our gut, digestive tract, our respiratory system, our cardiovascular system, our musculoskeletal system. There are just literally limitless possibilities and different tips and tricks that I've learned over the years with these. And for example, when in the wintertime, real quick, when I go skiing with the family, I unfortunately don't have time to train and everything to get my muscles up to speed for when the weekend comes and we go skiing. But what I do is Saturday evening, I will use the magnets on my quadriceps, on my hamstrings, on the different muscle groups that I feel the soreness coming on. And because they increase circulation and reduce inflammation, they're going to drain the lactic acid buildup. So the next day, I'm feeling fresh and I can go skiing and I'm not going to feel that soreness and discomfort and stiffness that I would have felt had I not used these to kind of, help my body flush everything and continue to improve my circulation. So everything from that to my daughter is in travel soccer. And so about a month ago, she hit her head real hard and she had a little concussion, a TBI, traumatic brain injury. And so she was very dizzy and confused upon getting up. And so my wife called me. I happened to be attending someone at the time. And I asked him, do you mind if I do a distance session and use your body as a bridge to work with my daughter's energy long distance? He said, go right ahead. And so I did that energy distance work. And then I texted my wife exactly where to place the magnets on my daughter. So my wife drove her home, She got home, put her on the couch. She placed the magnets on her, waited 15 minutes, took them off, asked my daughter how she felt. She's like, I feel great. I'm fine. I'm hungry. What's for dinner?
Wow.
And it's something like a TBI that should really be taken seriously, and maybe go to the hospital, or neurologist, or pediatrician. Uh, it was resolved quite quickly, just with a few simple pairs of magnets placed on her that brought the inflammation down immediately, that restored the pH balance in her head. So again, the examples and the options are limitless with this. Obviously, it's not going to help everything 100% because our body has a certain threshold point. So a diabetic patient that has had diabetes, or the pancreas has gone through extensive inflammation for over 20, 25 years, and they've been on medication, well, that pancreas has kind of passed a certain threshold point beyond which, as much as I try to heal it, it's not going to be able to go back down to the prior level. And so certain organ systems, areas, if they've passed a certain point of no return, well, there's not much that anyone can do for them. So, it's a case of trial and error, but I've definitely seen some miracles happen on many levels, and this, once again, is so beneficial that it can be combined with conventional allopathic medicine and medications and other procedures.
I love your story. It's almost like we need the magnets in our home first aid kit, right? Just for you to be able to help your family and everything. So no, that's
absolutely.
Yeah. Oh. Well, Dr. Garcia, you're a wealth of knowledge, and you just had your second baby girl. So congratulations. And I really appreciate you taking the time during this really, important time in your life. So thank you for taking the time to do this interview and share your knowledge and your expertise with us today. So I'm hoping everybody, we've definitely, made them more and more curious that they're going to check out your information and learn more and how to find a provider in their area as well if they want to seek out this therapy. So, yeah. Well, thank you so much for your time and being part of the summit.
Thank you very much, Dr. Schaffner. Appreciate it.